It's 58 degrees now, 10 minutes past 8 o'clock. Good morning to you. And I have to say good morning and welcome to our guest this morning. Doug Hovey is here, President and CEO of Independent Living. Hi, Doug. We've missed you.
Oh, hi, Kate. Good morning. Thanks so much for having me on today.
Yeah, sure. Glad to have you. We haven't talked for a while, but your mission remains the same as it ever has been. That you try to help people, well, live independently, duh. But seriously, people who want to live at home, regardless of what their difficulties and disabilities may be, you help them do that.
That's right. That's
That's
right.
that's a short version of everything. And it's a long list of things that you have to do to make it happen for people. But you are such a wonderful resource. And where shall we begin today?
Well, I should just tell you that our mission statement is that independent living is a consumer-directed cross-disability advocacy and service organization dedicated to enhancing the quality of life for all people with disabilities. And our vision is a barrier-free society where people have the opportunity to achieve their maximum potential. So that's our mission and vision statement. And we opened our doors in 1987. We were just a small organization, and now we've grown throughout the region and serve 7 counties of the lower Hudson Valley. We have 3 offices, one in Newburgh, one in Middletown, one in Monticello, and then we have a few satellite offices in Newburgh, in the greater Newburgh area, and then down as far as Westchester. And we work with people with all types of disabilities and all ages. And one of the important programs that we provide, Kate, is called Consumer Directed Personal Assistance Services. And this year, that was a big topic in the New York State budget. And as you know, the state budget was late this year. And the reason for that, one of the big reasons, is because the governor and the legislature were negotiating over this consumer-directed home care program that we started 30 years ago. We were one of the first organizations. It was me and several of my colleagues. We introduced this new consumer-directed model that allows disabled people to literally recruit, hire, and train their own workers to provide their care in their homes. And these are individuals that need assistance getting out of bed and getting bathed or showered and getting dressed in the morning, getting their meals made so that they can continue to be independent and live in the community. So that's the consumer-directed home care program. Now, when we started back 30 years ago, there were only about 15 or 20 organizations in the entire state providing this service. And there was probably around, I remember when the program grew to 2,000 people, and we thought, wow, that was magnificent.
Yeah.
But today, fast forward to 2024, there are over 600 providers in New York State and over 200,000 people that are receiving services through this particular model, consumer-directed home care. And so it's just grown exponentially. Part of that's good, but part of it's challenging because that level of growth is just not sustainable. So the governor and the legislature want to eliminate 588 out of the 600 providers.
What?
Literally.
What would anybody think the benefit would be of that?
Well, they believe that it can be administered through 12 or maybe 12 or 15 agencies. And we're very concerned about that because we think it's going to obviously disrupt the services for hundreds of thousands or at least tens of thousands of people across the state. So we're very concerned about this. We're working very closely with the legislature to try to make sure that the program is preserved, the integrity of the program, and that it doesn't disrupt the care for people who depend on this service every day.
It seems like if it was to be cut down to just a dozen or so agencies, that it would become more cookie cutter care. It would have to be following more. And the whole thing, as you've described it to me with consumer directed care, is perhaps the disabled person needs some specific help, which they can train someone to give them. It's all individualized. There's nothing cookie cutter about it. And that's important.
No, it's so true. And it's very individually tailored to meet the unique needs of each individual, this particular model. And families are very involved in the program, and the individual with the disability themselves, obviously, very, very involved in the program. So that's a big topic of ours. And we're also a resource for anyone who needs home care services, whether we provide the service directly for you or whether we help you to connect with another service that's available in your local community. So people should be aware that if they have home care needs and they're not sure where to go, they can contact us at Independent Living, and we can help connect them to the right resources so they can continue to live in the community rather than be displaced.
And your website is, please?
It's www.myindependentliving.org. That's www.myindependentliving.org.
Thank you. Okay, and that's a great place for people to start to get the information, to contact you and set things up and to start asking questions, because so many of us, when we start trying to look out for services, we're not really sure even what questions to ask. So you are a valuable resource.
Thanks. That's so true. And a lot of times people don't know the questions to ask. And when you're in the middle of it all and you're having to deal with a family member who has become disabled, sometimes very difficult to navigate the day-to-day needs of that individual and then figure out what resources that are out there that can help to improve the quality of life. So it can become extremely difficult and cumbersome and overwhelming at times. And
Yeah.
that's where we come in. We can help people to navigate through those bureaucratic systems that we're always having to deal with.
Okay. Now, I know that you also help people with housing.
We do, yes. We help people to find appropriate housing. One of the big challenges you always hear that there's a need for affordable housing. And we always say affordable and accessible housing, because the more that the aging population continues to grow and expand and more people wanting to live in the community, there's a tremendous call for accessible housing. And
Mm.
that's housing that's, ground level entrances, being able to get in and get around your house without stairs in the house, making sure your bathroom is accessible, the doors are wider, the kitchen is accessible. And there's, unfortunately, if you look at the existing housing stock today in Orange County, only about 1 to 2% of the housing stock is accessible. Whereas
Really?
that's about it. Yes. Unfortunately, most homes and most apartments are not accessible, and they need modifications in the home. So we can help with that. If people are faced with those challenges in their home and they need to make home modifications, they should give us a call, and we can have somebody come out and take a look and work with them to try to improve that situation.
Okay, and that can be even starting with a ramp to access the house from outside. And what other things inside?
Exactly. Yeah. Sometimes people, they have to be able to park their car and get out of their car safely, get
Yeah,
to get
sure.
to the front door, and sometimes that means installing a ramp. And once you get inside the house, the doors have to be wide enough. If you use a wheelchair, walkers, canes, crutches, things of that nature, you want to make sure your bathroom is accessible. A lot of times, homes might be one level, but the bathroom door is not wide enough. So
Mm.
that's an easy modification. These are simple modifications, and a lot of times people just don't know how to go about doing that. Sometimes it's removing the vanity under the sink to give a little more floor space and turning radius for wheelchairs, again, walkers, canes, crutches, things of that type that help people to get around their homes.
That's so important. Okay, so people can contact you for that. We're going to talk some more, but look at the time. It's 8:19 already. Let's take a quick break. We're talking with Doug Hovey from Independent Living, and we'll be right back on Wall. 821 at Wall Radio. And we're talking with Doug Hovey from Independent Living and Independent Home Care, serving disabled people and finding more ways to give himself more work than anybody I know, because there's always more to do, right, Doug?
There's always a lot to do. Yep. And this work is really a passion of mine, and certainly for my employees too. We have many of the employees that work for us, Kate, are people with disabilities themselves. So they know firsthand what it's like to have to, deal with barriers in the community and have to overcome systemic barriers and challenges in the environment, or even attitudinal barriers that sometimes can get in the way. So
Really, attitude. Now, I was just going to say, if there are barriers, I was just going to guess that it's mostly thoughtlessly done. That people without a disability don't even think that, oh, hey, nobody could get up these stairs here if they were in a wheelchair. If they would have a tough time if they had. But it's not just thoughtless. It's attitudes. How do we
yeah.
fix that? How do we fix that?
Well, it's a continuous process of educating people in our community, being visible, and through the Americans with Disabilities Act, we're able to provide a great deal of training and consultation around improving the accessibility of buildings and facilities and municipalities. And more municipalities in Orange County are reaching out to us for assistance in self-evaluating their facilities to make sure that they are fully accessible, and to provide training too, because I don't think anybody maliciously intends to offend people with disabilities, but sometimes just by lack of awareness, lack of information, sometimes
Certainly.
you feel left out, if you're not included. I was recently invited to a meeting by a particular town. And when I got to the meeting, there were steps to get in, and I use a wheelchair, so I was not able to get into the meeting. And they felt terrible. They hadn't thought about it. They were not intentionally trying to keep me out of the meeting, although maybe they were. I don't know. But anyway, sometimes it's just these are the oversights. So we have to be militant and keep educating folks, because our population continues to get older, and more older adults need accessibility, as well as the growing disability populations.
Yes, that's right. And you do that service for uh, other businesses. I don't know if you charge for it or anything, but you will come and inspect a business location to ensure that it is um, ADA compliant and accessible, right?
That's right. And we have staff that can literally come out and visit with a business and provide them with feedback on how to make their facility accessible and their services more accommodating, so that they can reach more people and include people with disabilities. And we don't charge for that service unless we're going to get really involved and start working with an architect. Then there might be a fee down the road. But initially, we'd be happy to come out, and we do work with several businesses in Orange County in particular, and provide that type of feedback for them. And a lot of improvements are made. And again, we just worked with one particular business in Middletown, and their bathrooms were not accessible, and they just were not aware. And they were so grateful that we could help them, and they modified their bathrooms, and now they're accessible. But a lot of times it's just awareness.
Yes, yes. And that's why you're here today to talk to us about it. Now, other things that you do at Independent Living, help with employment?
Yes, absolutely. Employment is such a huge topic, and we know how good we feel when we're working, and we know how we feel when we're not working. In fact, there's been a lot of studies that have been conducted, a lot of research and data that tells us being unemployed for prolonged periods of time can lead to great illness and depression and mental health conditions, and even substance use. Um, so we do try to assist people to connect with job opportunities. Most people with disabilities do want to work. And I think what happens oftentimes is when they're denied that opportunity 2 and 3 and 4 times, they tend to give up. And then so they become unemployed for long periods of time. And then they have to become dependent on government benefits.
A
Uh,
disability is way below the poverty line, as far as I know. It's not a fun lifestyle. Yeah.
no, it really isn't. You're right. And the majority of people with disabilities who are unemployed do live at or below the poverty level. They're living on a month-to-month check from supplemental security income, and they depend on Medicaid. Um, but there's a great program called the Medicaid buy-in program. So when a disabled person goes back to work, if they sign up for the Medicaid buy-in program, they can still earn as much as $74,000 a year and not lose their Medicaid benefits, which is really important because Medicaid is health insurance for disabled people, for many people.
Yeah.
Um, and so that's an important benefit. It's called the Medicaid buy-in program.
And people can call you to ask about that. And you also provide crisis response services.
Right. We're part of the Orange County Crisis Call Center, which is a 24-hour crisis response system. And it's actually situated right in the 911 center. And the crisis number is 988. So if someone's having a mental health or a substance use crisis in the community, they can call 988 and they'll get immediately connected to the crisis call center. Someone will screen that caller and determine whether a mobile outreach should be conducted. And then the mobile outreaches are provided by Access Supports for Living, our partner in the crisis call center. And then the Mental Health Association is the agency that actually, they're the ones who receive the calls and screen the calls and make the referrals for the individual to make sure that they're getting the support. And then Independent Living has peer counselors that go out and meet with the individuals and provide their support.
Okay. Wow.
It's a very important service, and people really should be aware that, again, if there's a crisis, mental health or substance use crisis, you can call 988. That's the it's a relatively new number, but it's easy to remember. So you're not having to dial an 800 number or some other number, right?
That's
Uh,
right.
988, it's a 3-digit, simple to remember, but anytime there's a mental health crisis, just call 988.
Okay. Thank you so much for coming on the air. It's been a while, but I'm so glad that you were able to come on and chat today and tell us everything you're up to. It's wonderful work, and any way we can support it, we want to.
Thanks, Kate. And can I mention one other thing? I also
Sure.
serve as the co-chair or the co-chairman of the Human Rights Commission here in Orange County. And June 28th is the Orange County Human Rights Commission Awards Breakfast. And I just want to put in a plug for that. If anybody's interested in attending the Orange County Human Rights Commission Awards Breakfast, it's going to be at Stony Ford Golf Course in Campbell Hall. And human rights is such an important topic today, and the Orange County Human Rights Commission is such an important agency here. I just wanted to put a plug in for that particular event.
Thank you. Tell us the date again.
It's June 28th, and it's going to be at the Stony Ford Golf Course in Campbell Hall. That's
June
June
28th. I will make sure we put it on the wall board too, so that
And if
people can
people need
find it.
more information, they can call us and what we can certainly share with them more
Okay.
information.
You want to share your phone number?
Sure, 845-565-1162. That's 845-565-1162.
Thank you so much. Doug Hovey, President and CEO of Independent Living.